Good morning. Myself, Dr. Terence Abraham, Reader, Department of Orthodontics, Royal Dental College. So today I am going to take class on etiology of malocclusion. So what is malocclusion that we have already discussed in the last class? So what are the various etiologies of malocclusions? So coming to the introduction, according to one quotes, the eyes cannot see what the mind doesn't know. That means a sound knowledge of various etiologies of malocclusion is a basic requirement for any orthodontic student. So, before starting to treatment or before starting a treatment for a malocclusion, we should know the clear-cut knowledge about the cause of the malocclusion or various etiologies of the malocclusion. Once we have corrected that etiology, then only we can get the maximum retention from our treatment. So, etiology of malocclusion is the study of its causes. That is a simple definition. Malocclusion is caused by either genetic factor or environmental factors. Comprehensive orthodontic treatment involves identification of possible etiological factors and attempt to eliminate the same causes. So there are various classifications proposed by various authors. All these classifications are based on are the classifications of various etiologies of malocclusions. The first classification is proposed by White and Gardner's classification, Salzman's classification, Moyer's classification, and Graeber's classification. The most important classifications of etiology is the Graeber's classification that we come into the detail. The development of normal dentition and occlusion depends on a number of interrelated factors that include the dentoalveolar, skeletal, and neuromuscular factors. So Graeber classified the etiology into mainly two factors, local factors and general factors. Local factors are one or more adjacent or opposing teeth are the local factors. General factors which affects the body as a whole. So first we go through the White and Gardner's classification. In White and Gardner's classification, he divided into three main headings, that is dental base abnormalities, pre-eruption abnormalities, and post-eruption abnormalities. Dental base abnormalities means the abnormality which happened in the maxilla as well as mandible. That may be because of their growth, or it may be direction of the abnormal growth, or abnormal rate of growth, or abnormal direction of the maxilla and mandible. So it is he classified the various causes in various planes of space, that is anterior-posterior malrelationship, vertical malrelationship, lateral malrelationship, and disproportion of size between the teeth and basal bone, then congenital abnormalities. That all these five comes under the dental base abnormalities. Then coming to the pre-eruption abnormalities, that is abnormalities in the position of a developing tooth germ, or in the presence of a missing teeth, presence of a supernumerary teeth, prolonged retention of deciduous teeth, and high labial freedom. All these can cause various malocclusions. These are the pre-eruption abnormalities. Coming to the post-eruption abnormalities, that means after erupting the dentition, there are various causes which can lead to malocclusion. Abnormal muscle activity, that means hyperactive mentality, that you can see in the class 2 D1 patients. So active muscle force, rest position of musculature, abnormal position of the muscles, then various sucking habits, thumb sucking, finger sucking. That these are the various sucking habits. Abnormal path of closure. You can see the abnormal path of closure in various malocclusions. For example, backward path of closure you can see in the class 2 div 2 patients, and pseudo class 3 you can see forward path of closure. So coming to the premature loss of deciduous teeth, extraction of permanent teeth, all these can cause the localized malocclusions. Coming to the next classification, Salzman's classification. He classified the etiology of malocclusions in mainly two types, that is prenatal and local. Prenatal and postnatal. Then in prenatal, we divided into genetic and differentiative. In postnatal, we divided into developmental and functional. And three divided into three: developmental, functional, and environmental. So coming to the prenatal causes of the malocclusions. First, genetic. Genetic, it involves genes plays an important role in the various malocclusions. For example, class 3, skeletal class 2, gummy smile, all these are highly involved with the genetic factors. So, in the malocclusions transmitted by genes, where the dentofacial anomalies may or may not be in evidence at birth. So, these some of the malocclusions is transferred from parents to the offspring, which may be visible at time of birth or which may be visible in the when the patient will become adult. Coming to differentiative causes, malocclusion that are inborn or engrafted on the body in the pre-functional embryonic developmental stage, it again classified into general, local, and congenital. That means certain malocclusions are embedded or inborn, which is present from the developmental stage, embryonic stage. In general means it involves entire body. Local means it affects only face, jaws, and teeth. Congenital means certain congenital defects, that is hereditary or may be acquired, but they are present at the time of birth. Again classified into general and local. Coming to the postnatal factors. Postnatal factors, developmental, there are three types. Developmental consists of functional and acquired or environmental. Coming to developmental factors, it again divided into general, that is, and local. General, it consists of various developmental abnormalities which can lead to malocclusions. The general factors are birth injuries, that is mainly forceps delivery. There will be injury to the TMJ and it affects the development of the mandible. Then various abnormalities which is related to rate of growth in different body organs. That means hypertonicity of the muscles, which can affect the dentofacial development and function. This is mainly because of the abnormality you can see in the muscles. For example, torticollis, that is an hyperactivity of the sternocleidomastoid or mastoid muscle, which can cause malocclusions. Then endocrine disturbances, which can also cause malocclusions. Nutritional deficiency can cause malocclusions. Various childhood diseases, exposure to radiation, these are the various factors which can cause malocclusions. Coming to local factors. Local factors involves abnormalities of dentofacial complex, abnormalities in the tooth development. These are the two subdivisions or subheadings of the local factors. Abnormalities of dentofacial complex. That means in the case of birth injuries, as I told before, the forceps delivery, any other birth injuries, then macronathia or micronathia. It is the abnormality in the development of the jaw, abnormality in development of the tongue, microglossia or macroglossia, abnormal frenal attachment. If there is any asymmetry in the face, such as facial hemiatrophy, all these can cause malocclusions. Then abnormalities of the tooth development, for example, delayed or early eruption of the deciduous tooth, then delayed or early shedding of the deciduous tooth, abnormal eruption of the certain tooth, in presence of impacted tooth, absence of teeth, all these can cause malocclusions. So these are the various local factors. Then coming to the functional factors. Functional factors consists of general and local. In functional factors, general mainly that is abnormal muscle activity, that is hyper or hypotonicity of the muscles, endocrine disturbance, neural disturbance, nutritional deficiency, postural defects, respiratory disturbances. All these can cause various malocclusions. Respiratory disturbance, for example, if there is any nasal polyp, patient has continuous rhinitis problem, if tonsillitis, adenoiditis, all these tends the patient to become a mouth breather, which later cause various malocclusions. Nutritional deficiency, postural abnormal postural defect, abnormal posture of the patient, abnormal posture of the head, or abnormal posture of the neck because of the certain muscle activity, which can lead to malocclusions. Neurotrophic disturbance means where neural abnormalities, for example, where neural if there is any uh, neural disturbances or neural diseases which can affect the muscles, which in turn cause the malocclusions. Various local factors can also cause malocclusions. For example, abnormal forces acting on the tooth, then loss of forces, or any disturbance in the temporomandibular joint, normal muscle activity, any faulty masticatory functions. All these can cause, these are the local causes of the malocclusions. Coming to the environmental causes. Environmental cause may be two types, general as well as local. In general, environmental factors, various diseases which involves in the dentofacial tissues or dentofacial structures, nutritional deficiency, endocrine disturbances, metabolic disturbances, trauma, accidental injuries, radiations, all these can cause. These are the various general factors which cause the various malocclusions. Diseases affecting the dentofacial tissues, that is general factors, that is it may be prenatal or it may be postnatal. Then endocrine disturbances, maybe pituitary gland diseases, thyroid deficiency, all these can affect the development of dentition as well as the development of the jaws. Various metabolic disturbances also affect the can cause the malocclusions. Then coming to local factors, abnormal force on the masticatory mastication, early loss or prolonged retention of deciduous teeth, delayed eruption of permanent teeth, loss of permanent teeth, early loss of the second deciduous molar, which can cause the first permanent molar to tilt mesially, which cause the malocclusions, various periodontal diseases, TMJ problems, infections in the oral cavity can cause the various malocclusions, various abnormal habits, trauma, all these can cause the localized cause of the malocclusions. Coming to another classification, Moyers and Dockrell classification. He classified etiology of the malocclusions into mainly five types: hereditary, developmental defects, trauma, physical agents, and habits. One more, and diseases as well as malnutrition. So what is hereditary? Hereditary, that means, as I told before, genes plays an important role in the development of malocclusion. Certain genes are involved in the development of the jaws. So neuromuscular, bone, teeth, soft parts, all these are under the control of the various genes. So these genes gets transferred from parents to the offspring. So same pattern of growth you can see in the offspring also. In developmental defects, then trauma, prenatal trauma or postnatal trauma, physical agents, various nature of the food. So early in the ancient times, our ancestors was our food was ancestors food was the uncooked food, mainly uncooked vegetables or uncooked meat. So lots of fibers were there in their food content. So because of the chewing or mastication, heavy load of mastication, there will be a proximal as well as occlusal attrition were there in that times. But in the future, in the recent period, all the because of the fast food, we are eating more fast food. There is less masticatory pores or acting during mastication. So there is negligible amount of attrition takes place as well as in proximal as well as occlusal. So crowding cases are more in the recent period compared with the ancient period. In ancient period, because of the proximal attrition, the crowding was not there. It was automatically corrected because of the proximal attrition. So that is the nature of the food involved in the malocclusions. Then premature extraction, early extraction of the primary teeth, that is the early loss of the second deciduous molar, which cause tilt, mesial inclination of the first permanent molar, which can cause various malocclusions. Various habits will also is a main important factor for the cause of malocclusion: thumb sucking, finger sucking, tongue thrusting, lip sucking, lip biting, various abnormal posture of the head and neck, nail biting, and various other habits are the main causes of the malocclusions. Then various diseases, like systemic diseases, syphilis, measles, mumps, all these has dental manifestations, endocrine disturbances, various local diseases like nasopharyngeal diseases, abnormal respiratory function, which can cause mouth breathing, periodontal and gingival diseases, various tumors. These are the various local diseases which can cause malocclusions. Caries also has important role in the development of malocclusions. The early loss of the permanent teeth, the early loss of the deciduous teeth due to caries, which can cause the tilt in the or inclination of the adjacent tooth and prevent the eruption of the permanent subcutaneous tooth. Then various malnutrition can also cause the malocclusions. Coming to the Dockeral equation, this equation states that for a malocclusion to occur, there will be a cause, that is the predisposing factors. These predisposing factors can occur either in prenatal period or in the postnatal period, and these causes it affects on the particular tissue, either primary tissue or secondary tissue. All three factors involved in the development of a results, that is the development of a malocclusion. First, there should be a predisposing factor. It may be hereditary, it may be a developmental, trauma, physical agents, habits, disease, or malnutrition. Any predisposing factors which happened in a particular time period or on a particular tissue, which results in the development of a malfunction or malocclusions. That is the Dockeral equation. Then next is the Moyer's Dockeral classification is already over. Then coming to the Graeber's classification. This is the most important classification of etiology of malocclusion. We classified malocclusion into mainly two types. Etiology of malocclusions into mainly two types: general factors and local factors. General factors, as I told before, genes or hereditary plays important role in the development of malocclusion. Various congenital defects, that is defects which are present at the time of birth, that is prenatal life, cleft palate, cleidocranial dysostosity syndromes, cerebral palsy, the trauma can cause cerebral palsy, congenital syphilis. All these congenital defects can cause various malocclusions. Environmental factors are in prenatal trauma. Mother is taking some drugs. If mother has some infections like German measles, all these affect the prenatal cause of the malocclusion. Postnatal cause of, in the case of hospital delivery, in the case of any trauma after during childhood can cause cerebral palsy, which is TMJ injury. Then various metabolic diseases such as endocrine disturbance, metabolic diseases, various infectious diseases like rubella infection, measles, congenital syphilis, all these can cause the malocclusions. Then malnutrition, abnormal posture, trauma or accidents, various abnormal pressure habits like thumb sucking, finger sucking, tongue thrusting, lip and nail biting, abnormal swallowing pattern, speech defects, mouth breathing, presence of adenoids and tonsils, bruxism. All these are the various general factors which can affect the can cause the malocclusions. Various local factors are the abnormality in the number of teeth, that is presence of extra tooth in the dental arch, that is supernumerary teeth, which can result in the crowding or prevent the eruption of the permanent tooth, missing tooth, which can cause malocclusions, abnormal shape of the tooth, high labial frena, early loss of the tooth, prolonged retention of the tooth, delayed eruption of permanent teeth. All these eruption or exfoliation disturbances can cause malocclusions, abnormal path eruption pathway, ankylosed tooth, dental caries, improper dental restoration. That means in the case of high points after restorations, if there is any occlusal prematurities which can cause the pseudo class 3 or TMJ problems. So these are the general and local factors of the malocclusions by Grabers. So when we come into the detail about each of this, the first one is the hereditary. Hereditary, as I told before, this is the main cause of malocclusion, and various traits or characters are transmitted from mother parents to the child. For example, Habsburg Joe of German royal family, because they are class 3, they all have in that family, they all have a skeletal class 3. That means the prognatic mandible can be seen. They are transferred from their parents to the mother for a series of generations. So then various human characters are influenced by the various genes according to the Lundstrom. So which are the various characters which can involved in the genes, that is tooth size, harsh dimension, crowding and spacing, abnormal tooth shape, abnormal number of tooth. All these are the various characteristics which is under the control of the various genes. In overjet interarch relation, that is mainly caused by and measured by high labial frenum, abnormal muscle activity. These are the various traits that are transferred from the parents to the offsprings. Then various congenital defects, that these are the developmental defects. They are malformation seen at the time of birth. They are associated with the malformation of first and second branchial arches. There are mainly two types of congenital defects: general congenital factors and local congenital factors. In general congenital factors, abnormal mother conditions during pregnancy, malnutrition, infectious diseases to the mother, various metabolic disturbances such as malnutrition, um, diabetes, endocrine disturbances, and trauma to the mother or trauma to the child can cause various congenital defects. Local congenital factors are the abnormal position of the fetus in the womb. For example, if the arm is pressed against cheek or chin is pressed against the chest, this can cause abnormalities in the development of the jaws. Presence of cleft lip and palate, macroglossia and microglossia, various syndromes. These are the various local congenital factors which can lead to malocclusions. Then these are the various congenital conditions we are usually encountered, that is cleft lip and palate. Various syndromes such as Perry-Robin syndrome. Then coming to the various teratogens, that is, these are the various agents or drugs taken by the mother during pregnancy. When the mother is taking any of these drugs during pregnancy, which results in the abnormality in their fetus. The common drugs such as aspirin, which can cause cleft lip and palate. The mother is taking smoking or alcohol. Smoking, it also causes cleft lip and palate. If mother is taking alcohol, fetal alcoholic syndrome or mid-phase malformations. If the mother is undergone X-ray radiation exposure, it causes microcephaly, decreased size of the head. Mother is taking some drugs, thalidomide, Valium. If there is vitamin D excess, all these has manifestations in the fetus. Coming to the certain infectious diseases in the child, which can cause kids in the cause malocclusion, such as congenital syphilis, which is transmitted from mother to the child. There are various manifestations in the congenital syphilis. You can see screwdriver shaped incisors, that is Hutchinson's incisors, mulberry molars, hypo enameloplegia, dental decay, and anterior prosper. These are the various dental manifestations in the congenital syphilis. Then another maternal infections such as rubella infection, various features such as dental hypoplasia, retarded eruption of the tooth, extensive caries you can see in the child. Various syndromes such as cleidocranial disorder, which is commonly congenital defects involving the unilateral or bilateral or partial or complete absence of the clavicle. In such case, you can see there is a retrognathic maxilla or prognathtic mandible. The child or kids has a tendency for class 3, skeletal class 3. There may be retained deciduous as well as retarded eruption of the permanent teeth. The roots of the teeth may be thin. These are the various features of the cleidocranial dysostosis, common syndrome which is present during the embryonic period or developmental period. If there is a trauma to the child, then leads to cerebral palsy, that is hypoactivity, that is lack of muscular coordination, and it occurs during birth injury. Coming to the various infectious diseases, as I told before, congenital syphilis. The tuberculosis also has effects in the dentition. For example, tuberculosis is infected by the bacteria, Mycobacterium tuberculosis. There is a presence of stunted growth and the retarded growth of the maxilla and mandible, delayed eruption of the tooth. These are the various features of the dental manifestation of the TB. Mumps caused by myxovirus. It has main effect on the enlargement of the salivary gland, but it can cause enamel hypoplasia in the fetus. Rubella infection, if the mother has a maternal rubella infection, which can cause various abnormalities in the fetus. For example, retarded growth and delayed eruption of the tooth, enamel hypoplasia. Coming to the various conditions, various syndromes associated with the class 2, class 3 malocclusions. Coming to the syndrome associated with the class 2 malocclusion, skeletal class 2. Syndromes are Pierre-Robin syndrome, Treacher-Collin syndrome, Page's diseases are the mainly three syndromes which are associated with the skeletal class 3. Then various syndrome associated with the skeletal class 3. Sorry, before was skeletal class 2 and now I am discussing with the syndrome associated with the skeletal class 3. Cousins disease, cleidocranial dysplasia, achondroplasia, cleft lip and palate, congenital syphilis, Down syndrome, acromegaly, all these can cause skeletal class 3 malocclusions in the fetus. Coming to the various environmental factors, it may be prenatal or it may be postnatal. Prenatal environmental factors, as I told before, abnormal fetal posture. If mother is taking drugs or any metabolic diseases of the mother can cause the prenatal abnormal malocclusion, causes of malocclusion. Postnatal factors are the birth injuries, any if there is a patient has scoliosis, for treatment of scoliosis we give Milwaukee braces. In Milwaukee braces we take anchorage or support from the mandible, so it results in the retrognathic or retarded growth of the mandible. In various abnormal muscle function, that is facial muscles, can affect the jaw growth mainly in two ways. One is formation of bone and the point of muscle attachment depends on activity of the muscles. So if there is any muscle dysfunction or muscle fatigue, it will affect the microskeleton, that is the bone at which the muscles attached. The growth of musculature normally carries jaw downward and forward. The muscles also has a role to control or to direct the growth of the jaws in the forward and downward direction. If there is an excessive muscle contraction that you see in the torticollis or right neck, excessive contraction of the sternocleidomastoid muscle, which results in the facial asymmetry. Then in the case of cerebral palsy, there is lack of coordination of the muscle. There will be hypotonicity of the muscle, which results in the drooping of the mandible, increase in the anterior facial height, as well as to disturb the buccinator mechanism, and there will be a posterior crossbite. This is the right neck, and this is the Milwaukee braces we give for scoliosis. These are the various abnormalities in the number of teeth. For example, supernumerary teeth, that is extra tooth which are present in the dental arch. Then abnormalities in the tooth size, microdontia, macrodontia, fusion, gemination that we have already discussed. You must have known all these terms in the third year or in the when you had oral pathology classes. I am not going deep into all these anomalies. Then anomaly in the tooth shape, like shaped laterals, abnormal large cingulum, additional lingual cusp in the mandibular second premolar, screwdriver-shaped incisors seen in the congenital syphilis, talons cusp, dilaceration that bend in the root, dents in dentae, then abnormalities in the labial frenum. So labial frenum abnormality, high labial frenum is commonly diagnosed by using the Blanch test or by taking the IOPA. These are the various local and systemic factors which are associated with the delayed eruption of the permanent teeth. So I'm not going deep into all these things. Prolonged various causes for the prolonged retention of the deciduous teeth. These are the other causes of the malocclusions. Endocrine imbalances, mainly hypothyroidism, that means deficiency of thyroxine hormone. That there are various uh, dental manifestations like delayed tooth eruption, delayed calcification, or retained deciduous tooth, abnormal root resorptions. All these can cause various malocclusions. Then increased thyroxine hormone, hyperthyroidism, which retard the orthodontic tooth movement, increase metabolic rate, early eruption of the deciduous and permanent teeth. Then parathyroid hormone, in the case of deficiency in the parathyroid hormone, which could decrease the calcium mobilization from the bones and teeth, decrease the blood calcium level, which can result in the delayed tooth eruption. In the case of increased parathyroid hormone in the blood, which causes mobilization of the calcium from the bones and teeth, increased blood calcium level, it causes mobility of the teeth. So these are the various, as I mentioned before, various endocrine disturbances which cause malocclusions, various pituitary disturbances, pituitary gland disturbance, thyroid gland disturbance, parathyroid gland disturbance. And coming to the metabolic disturbance, that is, it involves nutritional deficiency, endocrine disturbances, various diseases like diabetes, all has the main direct role in the development of the malocclusions. So various vitamin deficiencies which can also cause leads to malocclusions. In pregnant women, if there is increased vitamin A, hypervitaminosis A, or insulin deficiency, iodine deficiency, riboflavin deficiency, all these can cause malocclusions. In child, if there is a deficiency vitamin A, deficiency in vitamin B, which can affect the growth of the child. Vitamin C deficiency, vitamin D deficiency, increased vitamin D. So vitamin D deficiency leads to disturbance in the calcification of the tooth, enamel formation, delayed eruption of the tooth, early exfoliation of the deciduous tooth, then growth of the maxillary and the mandibular arch. So nutritional deficiency, various malnutrition, as I told before, vitamin deficiencies, abnormal posture of the child. The child who support their head by resting chin on their hand, which have mandibular deficiency. Then trauma, which cause condylar fracture or TMJ issues, which can result in the facial asymmetry. If there is a presence of scar tissue after cleft lip surgery, which can restrict the growth of the surrounding tissues and results in the facial asymmetry. So these are the main causes of the malocclusions. So I hope today's class all have understood little, at least the basic things about the etiology of malocclusion. If you anyone has any doubt, you can ask me at any time. Okay, thank you. We are going to wind up to today's class. Thank you. Thank you so much.